Hello, my name is Bill Clark. I'm the chapter leader for the Greater Brunswick Area chapter of Maine AllCare, and it's my pleasure to introduce you to the virtual presentation we've created called A Community That Cares. We have solicited 15 or so people from the area to talk about why they are interested in universal health care. Speaking for myself, as a retired physician, I've been concerned for a long time about the inability to provide the quality of care that patients deserve because of the intricacies and deficiencies in our private health insurance-based healthcare system. Further, right now, I'm concerned because our son, who is a writer, is unable to buy health insurance because writers don't earn very much. This problem extends, of course, to many citizens across the state of Maine. And further, we know we can do better. Just look at Medicare, which has successfully provided quality care for our elderly population for over 55 years, providing patients with full choice of provider and full control over their own healthcare decisions. So, with that introduction, let's tune in together to see and hear what our local citizens think about universal health care. And thank you so much for attending with us.
Hi, I'm Dr. Julie Pease, and I'm from Topsom. I'm a physician, and I've practiced psychiatry in Maine for about 30 years. I've also had the privilege of practicing medicine in New Zealand. Through my work in New Zealand, which is a country with universal health care, I have become passionate about bringing universal health care to Maine. I became a founding member of Maine AllCare after contacting my then state representative, Charlie Priest, to express my strong support for his universal health care bill for Maine. At Charlie's invitation, about a dozen of us gathered around a kitchen table in 2010, and we created Maine AllCare. Over the past 10 years, Maine AllCare has grown to include almost 40,000 supporters. Now, here's just a couple of reasons why I advocate for healthcare for everyone in Maine. Over the years, I've become dismayed and, frankly, disgusted by the increasing dominance of the for-profit insurance industry in our healthcare system. They are managing healthcare in the U.S. and Maine and making treatment decisions that should be left to doctors and their patients. I've found that when I work with my patients, I have to spend more and more time fighting with insurance and managed care companies to get authorization for necessary treatment, and instructing my patients on how to navigate our increasingly complicated system, finding out where they can pinch pennies to be able to afford their medications, and advising them on negotiating payment plans. This takes away from the time that we would otherwise spend on their actual health care. In the United States, we pay twice as much per person as most other developed countries, and yet our outcomes are not as good. Many Mainers live with the fear of medical bankruptcy, and because of this, they delay going to the doctor if they get sick. Our health care is rationed, but it's rationed based on a patient's ability to pay. Hospitals and clinics in Maine are cutting back on essential services such as diabetes care because they are not profitable, and essential rural hospitals and clinics are closing because they cannot make ends meet. I will continue to be a tireless advocate until we have universal health care in Maine, until everyone in Maine is covered and Mainers can get the health care they need, when they need it, and where they need it.
I'm Dan Ankeles, one of Brunswick's 2 at-large town councilors, and I support health care for all. As a progressive, I believe that health care is a right, that no family should go bankrupt because they get sick, and that no one should have to choose between heating their home and paying for medicine. Believe it or not, health care for all would have a huge impact on local government. As a local elected official, I've got to pass a budget each year, and that budget includes rising health insurance premiums for our town and school staff. Make no mistake, these dedicated employees have earned these benefits. But should communities really be sending our property tax dollars into the pockets of wealthy health insurance executives? I don't think that's a fair or just system. With healthcare for all and a more progressive tax code at both the state and federal levels, we have the opportunity to cover every Mainer and make sure retirees and working families have more money to cover basic expenses. This year, our town council unanimously passed a resolution in support of healthcare for all because we believe that a healthy community is a more prosperous community.
Hi, my name is Susan Kamin, and I live in Brunswick, Maine. I'm a certified nurse midwife, and I've worked in the healthcare system for over 30 years as both a nurse and a midwife. My experience has shown me that our current healthcare system is not working, since it does not provide equitable healthcare to everybody. From working in the system, I know this country has the resources to provide healthcare to all, yet we have decided that not everyone has the right to be healthy. This is the reason I joined Maine AllCare. I was introduced to midwifery and universal health care when I lived abroad many years ago. Even though the country spent a fraction of what we do on health care, everyone had access, there were fewer racial and socioeconomic healthcare disparities, and midwifery care was fully integrated into the system. The United States is one of the only countries in the world that does not standardize midwifery care, nor has it implemented universal health care, yet we do have the distinction of having worse maternity outcomes than any other industrialized nation. In the years I have been a midwife, I have gathered way too many stories about how our healthcare system is failing the people who live here. Those who had to choose between taking a medication or buying food. Those who could not afford preventable health screenings and therefore did not benefit from early disease detection and died from something that should have been preventable if it was caught early. Those who do have health insurance, but with high deductibles, copays, and other forms of cost sharing, still go bankrupt from health care expenses. And the young new moms who are forced to return to work sometimes only days after having a baby so they could make ends meet. I joined Maine AllCare because I believe healthcare is a basic human right. All of us will benefit when everyone has access to quality health care.
Hi, I'm Dan Meyer. I've lived in Maine for almost 35 years, here in Brunswick for the last 5, and I'm delighted to talk about Maine AllCare, a single-payer system for Maine. My job here in Maine was to teach family doctors. As a sociologist, I taught them public health, community medicine, evidence-based medicine, communication skills. I also helped do research and write grants. And one of the grants we worked on was to get social workers, which we had in our practices, still there after almost 20 years. And they got medications for our patients, which insurance doesn't cover. It helped them find insurance if it was possible to find insurance for them. And they cajoled specialists to give free care if we could possibly find it for our patients. On a personal level, I became disabled in 2009, lost that job, and then we lost our insurance. My wife didn't have it through her employer. So we paid more than $1,000 a month for our $5,000 a year deductible until the disability turned into Medicare for me. But my wife still had to pay that for 5 more years till she became eligible for Medicare. Every other country in the world has single-payer systems of one kind or another. And we need one for Maine right now. Thank you.
Hello, my name is Dr. Cynthia Dechenes. I'm a family physician in Midcoast, Maine. I've been a family physician for over 20 years, and during that time, I have seen many, many people not get care that they need because they couldn't afford it. I think that this is not befitting of a country of our stature, and other developed countries are able to support their people and offer preventive services and health care without bankrupting their people. I strongly support Maine AllCare, and I support the publicly funded option for health care, just as many other developed countries have been able to do. Thank you.
Hi, my name is Terry Pratt, and I'd like to take a second to talk to you about healthcare, Maine AllCare in particular. I've been a resident of Maine for almost 20 years. I live with my wife and children in Brunswick, Maine, and I manage a private practice physical therapy clinic in Topsom, and I have for 13 years. To say healthcare has impacted my life is an understatement. When I was 14 years old, I lost my mom due to cancer, a glioblastoma, brain tumor. We dealt with the heartache of losing a parent, but what we didn't deal with was the potential bankruptcy that ensues with medical bills to get the best care possible. That's because we lived in Canada. Healthcare should be a human right. And in this country, the average family healthcare premium per year is close to $20,000. That's unsustainable. So personally, I have seen my premiums increase over the past 2 decades. At the same time, professionally, I've seen my reimbursement plummet. At the same time, I see patients coming in with the heart-breaking decisions of, am I going to choose medicine or healthcare? Co-pays are going up. More people are going into medical debt than we've ever seen before. The current status of healthcare in this country has eroded our confidence in the system, has eroded our incomes, and has eroded our personal health. And we can do better. If COVID-19 has taught us anything, it's that the current healthcare system has not been designed to take care of people who are sick. We can do better, and this coming November, when you're making choices about who is going to support healthcare for all, and healthcare is a human right, make sure that you take a look at Maine AllCare and the choices that are available to you individually. It'll make a difference over time because the current situation is unsustainable.
Hi, I'm Pam Gross. I've lived in Maine 35 years. After living in Bangor for many of those years, I moved to Brunswick, Maine. I'm here today because I think universal health care is essential for building a compassionate society for all people. I am a retired minister and a retired hospital staff chaplain. As a hospital chaplain, I witnessed again and again needless suffering of patients who experienced that because they didn't have insurance. Patients who delayed seeking care because they had no insurance. Some of the patients would die because of the progression of their illness, and others would need extensive care that cost so much it added to the burden of their already burdensome illness. But also, I'm here as a 16-year metastatic breast cancer survivor. My treatments over the years have changed, mostly for the better, but I'm still here gratefully. But the cost of those treatments has also increased dramatically. Because our insurance system exists to profit from our medical care, not out of concern for our well-being, I quickly learned that I needed to be a watchful advocate for myself as a patient. I now have regular conversations with my insurance company, negotiating for treatments that they have deemed unnecessary or arguing for the ones that my oncologist has requested. And add to all of this the constant worry that coverage for pre-existing conditions remains a question mark. It remains a question mark whether I have insurance coverage or not. Well, hopefully with all this you can see why I think it's incredibly important that we build a universal healthcare system for all people now. Access to health care should not depend on how much money we have or don't have, where we work or we don't work, or what kind of an illness we have or don't have, or whether an insurance company makes a profit. For me, my health care has been a gift that has sustained me for 16 years. And because of that care, I got to meet my first grandchild 4 years ago. That is priceless. We need universal health care now.
Hi, my name is Susan Tarpinian, and I live in Brunswick. I own the Morning Glory Natural Foods for the last 40 years, and I think that everybody should have health care. I try to provide health care for all my employees, but it's getting more and more difficult every year. It's getting more and more expensive, and there's very little choices for the plans that they need. The plans are regularly just catastrophe plans. There's no plans for them to go to the doctor and stuff because it's so expensive. So every year we have the insurance companies come and negotiate with us and find out what we can do with them and how much we can afford. And it's just really, really hard on the employees. It's hard on us because I do believe that everybody should have health care. And I'm hoping that that will happen here in Brunswick or in the whole country as soon as we can do something about it, because there's so many people that are without health care and they need health care, and I'm hoping this will help. Thank you.
Hi, I'm Rosalie Paul. I live in Brunswick, and I am a staunch supporter of Medicare for all, universal health care, whatever it takes to get the insurance companies out of our health coverage. I find it stunning that anybody continues to believe that an insurance company that's making all kinds of profits and deciding what's too expensive for them should be in charge of our health care. I would far rather pay a flat sum into the system as everybody else did, and have us all covered equally for all kinds of health. I think it just is sensible. It's also been shown that it would be less costly than the current system, which has all kinds of profits tucked into it. So please think carefully about how much you're paying now and how much peace of mind it gives you, how much you feel sure will be covered without additional costs. And join me. I have Medicare now because of my age, and I don't pay anything else. I simply have a monthly sum that goes to Medicare, and I also have a supplement with AARP in case there are some things that aren't covered by Medicare. And I am on Easy Street. It's wonderful. And I know that it's a system that everybody could enjoy, and that's what I hope for. Thank you.
I'm Jean Sawyer, member of the Brunswick chapter of Maine AllCare. Even before healthcare became a divisive national issue, on general principles, I always felt universal healthcare was important. Parallels can be drawn between the climate change and the breaking down of the healthcare system. Years ago, the melting glaciers were almost imperceptible. In about the 80s, I began to see changes in the healthcare system. The glaciers are still melting. A few decades ago, it became much worse with healthcare. Prices went way up. It became unaffordable for many people, and many more people fell through the cracks or went into bankruptcy because of healthcare. As a supporter of universal health care, I believe that health care is a right, that a society has a moral responsibility to look after the care of its people, that health care is not a commodity, and it should not be the source of excessive profits. Now we see glaciers falling, visibly separating into the oceans, and healthcare has reached a crisis point. COVID-19 has shown us that the wrongness of connecting employment with healthcare, especially at a time when millions of people are losing employment. And also it has shown us how healthcare should not be so connected to the political system. Long ago, it was time to fix this. Most of the countries of the world have managed to take care of its people and to with less cost and better results. Now is the time to fix this. Universal healthcare would result in healthcare justice. A society that felt cared for would more likely be a unified society. Universal healthcare would be the start of moving our society forward in a much better way.
Hi, my name's Gail Eaton. I'm a resident of Topsom, Maine, and a firm believer in health care for everyone. I find it very discouraging that we are one of the most industrialized countries in the world and do not provide health care for all of our citizens. I firmly believe that health care is a right, not a privilege. No one should have to worry about deciding to pay for either meds or food, housing, whatever. It is totally shameful that we allow that to happen in this country. And the current COVID-19 pandemic has certainly shown us what a total disaster our system is currently. As such, I'm a member of Maine AllCare. It is a group that is working to providing health care insurance for all Maine citizens. And I'm hoping maybe some others of you out there will join us in that fight. Thank you very much.
Hi, I'm Marla Davis, a retired nurse from Woolwich. And throughout my 46 years of nursing practice, I have directly observed the many inequities of how healthcare is provided in our country. In 2016, I joined the Brunswick area chapter of Maine AllCare because I wanted to get involved in something that promoted a universal and equitable healthcare system. In these videos, you have heard the many compelling reasons why everyone should be covered. And a common theme is healthcare as a right. I'd like to add a bit more about this right based on the terrific little book recently published by Tim Snyder. The book is called Our Malady: Lessons in Liberty from a Hospital Diary. Several revered documents speak out for healthcare as a right. The Constitution of the World Health Organization and the United Nations Universal Declaration of Human Rights, both adopted in the 1940s, are strongly supportive. In fact, the U.S. was involved in their development and thereby helped other countries, the world round, to have healthcare as a right, but not us. But even further back, we remember 1776 and King George III. The preamble of our Declaration of Independence states, "We hold these truths to be self-evident, that all are created equal, that we are all endowed by our Creator with certain inalienable rights, and among these are life, liberty, and the pursuit of happiness." It may seem redundant, but I beg the questions. Can we have life without health and health without health care? Can we be free if we are ill or stressed, or if the people that we care about are struggling? Can we pursue a life of happiness if we are sick of body or spirit or full of fear? As a military wife, I have had the privilege of a gold standard health care my whole adult life. Our military are essentially covered by a universal type system. All of us deserve this. A healthy democracy can only exist when its constituents are healthy.
Hello. Please join me in thanking this diverse group of local citizens who shared with us their ideas, concerns, and hopes regarding universal health care. We noticed that their concerns are the same as all of our concerns, namely with affordability, choice, control over care, and less hassle. In fact, the U.S. does have an effective system that we could follow up with, namely Medicare, which cares for some of the sickest among us, elderly, kidney transplant patients, and disabled persons, and does so at a far lower cost than private insurers can do. Maine is, in fact, working in this direction, led by Maine AllCare. Our economic feasibility study conducted last year showed that this is definitely possible at the state level. A survey we conducted showed 80% support for doing something like this. Several cities have passed resolves demanding that the legislature implement a program of universal health care, and we will soon be starting a ballot initiative. The initiative has been okayed by the Secretary of State, and you will be hearing from us soon as we request signatures and somewhat later your vote on this matter. Thanks again for tuning in with us, and we hope to see you again before long. Goodbye for now.